Hello friends and welcome to your YouTube channel, My Expert Doctor. I am Dr. Shalini Singh Salunke, your consultant physician. Through this channel, we aim to provide you science-based, health-related, authentic information directly from medical expert so that your future can become happy and healthy. Now, today we are going to discuss a very important and common problem. Every second person is affected by this condition at least once in their lifetime. Usually it is very simple. It gets cured by itself or with some simple medications, but sometimes in some patients it becomes severe and life-threatening as well. We are talking about urinary tract infections, or commonly called as UTI. In today's video, you will be getting a complete information about this thing. We will discuss what is urinary tract infection, what are the risk factors, what are the symptoms associated with this disease, what are the lab investigations which should be done if you have this particular problem. Also, we will be discussing some basic treatment plans as per your condition and certain home remedies which can help you to cure this problem at home. Also, at the end of this video, we will be discussing some preventive measures so that you can avoid this condition altogether in your life. So let's start today's video. So before understanding this particular problem, urinary tract infection, let's understand the urinary tract or excretory system of human. So it starts from kidney. You have two kidneys on the lower back of your body. These two kidneys form urine. Urine is the excretory product or waste product of your body. It carries urine from ureter and store it in the urinary bladder. Once urinary bladder has reached its maximum capacity, it gives a signal and you feel like emptying your bladder. You go to the washroom and then the route with which you remove or excrete out your urine, that is your urethra. So you have urethra, urinary bladder, ureter and kidney. All these four parts combine together to form the urinary tract. The most common site of bacterial infection or attachment is the urethra and urinary bladder. If the infection is restricted to urethra, it's called urethritis. If it reaches or ascends to urinary bladder, it is called cystitis. These two conditions are called lower urinary tract infections. But in some cases, it might ascend up to the kidneys, and that is called acute pyelonephritis. Now that is a serious problem. You cannot treat acute pyelonephritis at home by yourself. You have to reach out to a doctor. They will guide you. Now let's understand the risk factors. Usually it is found more commonly in females. The female to male ratio is around 4:1. The reason being females have shorter urethra and urethra is closer to their anus. So the organisms from the anus can migrate towards the urethra and cause infection, or because of shorter urethra, it is easier to pick up the dirt from the toilet seat and get infected. The other one is intercourse. Usually after intercourse, the frequency of acquiring urinary tract infection increases. Then there is diabetes mellitus, catheterization, large prostate, contraceptive methods like using diaphragm, sponge or vaginal cream. Also, perimenopausal and menopausal conditions can also become a great risk factor for acquiring this disease. Now moving on to symptoms. What symptoms are associated with this particular condition? Now if you have lower urinary tract infection, that is either urethritis or cystitis, you might develop these symptoms. Burning micturition, that is burning sensation while passing urine or towards the end of passing urine. Urgency, you might feel of going to washroom again and again very frequently. Hesitancy, that means you will have to wait for some time and then your urine flow will start once you're in the washroom. Lower abdominal pain, there is increased frequency. Feeling of incomplete bladder evacuation. Foul smelling urine, cloudy urine, or sometimes you might see some blood drops in urine, that is called hematuria. But if you have developed acute pyelonephritis, your symptoms will also include flank pain, fever, chills, nausea and vomiting, anorexia, because it's more of a serious condition. Now moving on to lab investigations. Once you have all these symptoms and you have gone to a doctor, the doctor might ask you to do certain lab investigations. So what are they? First thing is your urine sample or urine tests. For urine test, you will require urine sample. So the doctor will provide you a container, which is a sterile container. You'll go to the washroom. First and foremost, you have to clean your private part. Second thing, you have to flush out certain amount of urine from the initial flow, and you have to collect the midstream of your urine. After collecting these samples, you will be giving this to the lab. The lab people will perform certain tests on it. The first one is urine dipstick test. That is, they will check nitrite and leukocytes esterase test. If they are positive, it's indicative that you have certain urine infection. The second thing is your urine routine microscopy, in which they will be seeing your pus cells, that is your WBC, and the presence of bacteria, presence of red blood cells. The same urine sample will then be tested for culture and sensitivity. This particular sample will be tested for the growth of bacteria. Usually it takes around 48 to 72 hours for these bacteria to grow and being shown in the sample, and then they will run sensitivity of different antibiotics. That means which antibiotic can be useful, or which organism is sensitive to which particular antibiotic. Now, apart from your urine report, there are certain other blood tests also which your doctor might ask you to do. That is CBC, complete blood cell count, to see the increased number of WBC. The others are the serum creatinine and BUN, that is blood urea nitrogen, which can help your doctors to assess the functions of your kidney. Then apart from that, you have some certain imaging as well, like X-ray, sonography, CT scan, MRI. So what are the selective cases in which they might ask you to undergo imaging? One is recurrent infection, second one is hematuria, the third one is when stone is suspected, fourth one when your fever is up or higher side for more than 3 days, then if your antibiotics are not working, or there are certain other complications of UTI. So these are all the lab investigations. Now what the doctor will prescribe you? After going through your lab reports, that is your urine routine microscopy, your CBC and other things, doctor will prescribe you a broad spectrum antibiotic, because your culture reports are going to come after 2 to 3 days. So till then you will be given a broad spectrum antibiotics. What they might be: ciprofloxacin, doxycycline, minocycline. They might prescribe you cephalosporin combinations, or sometimes your nitrofurantoin, ciprofloxacin and other. There are many antibiotics which the doctor might prescribe you, but please don't take these without doctor's prescription. Okay. Now after these antibiotics, doctors might also ask you to do certain other things which are supportive measures, which are equally important. First one is drink plenty of water, at least 8 to 12 glasses of water every day, because when you will increase the quantity of water intake, your urine formation will also increase, which will flush out the bacteria. Second one is your cranberry juice, which is unsweetened juice. Around 240 ml you can consume per day. It has also shown, the scientific researchers have shown that these cranberry has certain component or certain factors which do not allow these bacteria to attach to the walls of urethra or urinary bladder. So the infections can be cured at a faster rate, or it can help in prevention as well. Vitamin C in food or supplement, garlic extract, yogurt. You can also use hot water bags in the lower abdomen if you have lower abdominal pain while passing urine. You have to completely avoid taking alcohol, coffee or soft drink, as well as they might give you certain analgesics for your pain and fever, and also some alkalinizing agent which can provide you symptomatic treatment. In next 72 hours, you will get your culture sensitivity report, and if required, doctors might change your antibiotic reports. So after this starting of this treatment, you might start feeling better within next 36 hours. Now, how can you prevent this urinary tract infection? Because why do you want to suffer from this problem if you can prevent it? So let's see how can we prevent it. The first is never hold your urine for a longer time, because the urine are usually contaminated with bacteria. So if you hold it for longer time in your bladder, the bacteria will get higher chances to get attached to the wall and cause infection. So if you feel like passing urine, please go ahead, don't hold it for a long time. Clean toilet seats properly before using. After using toilet, wipe from front to back, because your anus contain organisms. These bacteria are naturally present in your anus. So if you will wipe from back to front, you will introduce those organisms into your urethra. So never do that. Always clean from front to back. Also, follow good sexual hygiene. How can you do that? Avoid diaphragm and vaginal sponge. Instead, you can use condoms, pass urine after sexual intercourse, wash your private parts properly after each intercourse. So these are certain preventive steps. Of course, you have to drink water, you can continue taking vitamin C supplements, you can also take cranberry juice. So in this video, we have understood what is urinary tract infection, what are the risk factors, what are symptoms, how can we treat it, what lab investigations are required, also how can we prevent it. Hope this particular video would have provided you all information you were looking for. That's all for today. In next video, we'll be coming back with some other important health related topics. Till then, stay safe, stay happy at your place.